forearm. Thus it has the greater range of movement. Number second, oblique fasciculus means that they are obliquely to each other. They are making angle to with respect to each other. First one is the triangular adductor longus. This one we can say that it's a shape of adductor longus. Second is the fan shape. Temporalis muscle. This one here, this one is the temporalis muscle. This is a fan shape oblique fasciculi. Third one is the pennate fasciculi. Pennate fasciculi unipennate, like this one arrangement. These are the muscle fasciculi. Flexor examples are flexor pollicis longus, extensor digitorum longus, and Pernus tertius. Second is the bipinnate, like this one. They have muscle fasciculi arising from both sides, like this. This is the aponeurosis. Again, on the side of each aponeurosis, there are muscle fasciculi are arising. Example will be rectus femoris, dorsal interosseous, Pernus longus, flexor hallucis longus. Multipinnate. The muscle fasciculi are arising from many directions, from many ways, just like a deltoid subscapularis. Deltoid muscle, just like this one. This is the example. Deltoid subscapularis. This one. Circumpinnate means that it is arising as a circumference, just like the circumference. Example are tibialis anterior. Here we can see that here. And twisted fasciculi means that their fasciculi make a band which may be one or more many times. Found in the trapezius, just like this is the trapezius. Here, this is the trapezius. Latissimus dorsi, this is the latissimus dorsi. Pectoralis major, this is the pectoralis major. Again, there is making a band here. And supinator, which is not shown. Cruciate fibers. In certain muscles, the fasciculi are crossed. Just like means that more than one muscle fasciculi are crossing each other, like zigzag position. Example will be sternocleidomastoid, masseter, and adductor longus. Here we can see that many muscles are crossing each other and masseter region. This is a sport where we can say that there are cruciate fibers, means they are crossing each other. Nomenclature of muscles. Muscles can be named in a number of ways, like they are named on the basis of their shape, like trapezius, trapezoid shape, rhomboideus is a rhomboid shape, serratus anterior, latissimus dorsi. Number of head of origin means that the head of their origin. Bicep have 2 head of origin, tricep have 3 head of origin, quadriceps and digastric. Gross structure: semi-tendinous, tendinosis, and semi-membranosis. On the and their on the basis of their location: temporalis, supraspinatus, intercostal. Intercostal is between two costal cartilage. Supraspinatus above the supraspine. Temporalis region here. On the basis of their attachment: stylohyoid, cricothyroid, mm, means that styloid process of temporal bone, hyoid portion, cricoid cartilage, thyroid cartilage. Function: on the basis of their function: adductor longus, flexor carpi ulnaris, means the adductor will cause adduction, flexor will cause flexion, abductor pollicis longus means it will cause abduction. Direction of fibers means that on the basis of direction we have named some muscles like rectus abdominis, means this one, rectus abdominis, toward the we can say toward the rectum direction. Oblique abdominis, this is the oblique abdominis, obliquely going transverses. Now, lubricating mechanisms. We have some mechanism to which we can reduce the friction between two mobile surfaces. Like first one is the synovial bursa. Synovial bursa is a closed space bounded by a synovial membrane and synovial in which there is a synovial fluid. The structure is a closed space of synovial membrane with a capillary film of synovial fluid. Here we can see that there is a fluid, there is a membrane outside. Second one is the synovial sheet. When the tendons are passing under the fibrous bands, like when there is a chance of any damage to the tendons, some synovial membranes surround these tendons, which we will call as the synovial sheet. Here we can see that tendon is going. Here is there is a synovial sheet surrounding the tendon, formed by the invagination of tendon into the sheet, like this one. Two layers are separated by a capillary film of synovial fluid. Like that, there is a synovial containing fluid. Blood supply of the skeletal muscles. They derive their blood supply from muscular branches from which arise from the neighboring arteries. There is a point at which in a muscle where arteries enter, veins come out, and motor nerve go inside the muscle at a point called the neovascular hilum. The arteries in the perimysium, they rapidly divide into to form arterioles and capillaries in the endomysium for nutritive circulation. Nerve supply of skeletal muscles. There is one motor there, and second one is the sensory innervation. Motor innervation: 16% innervation to the skeletal muscle is by motor fibers. Like there are three types of motor fibers. First is the alpha efferents, gamma efferents, and autonomic efferents. Alpha efferents are large nerve fibers. Gamma efferents are small nerve fibers, and autonomic are fine, very fine nerve fibers. Again, on the basis of myelinated, alpha and gamma are myelinated, whereas autonomic is non-myelinated. Uh, Alpha afferent supply the extraphysial muscle fibers, means that the part of the muscle which produce contraction is called the extraphysial, which is supplied by the alpha afferent. Where intraphysial is a sensitive part of the muscle, which is again supplied by gamma afferent. Autonomic afferent supply the smooth muscles of the blood vessels of inside the muscle. Second one is the sensory fibers. It make up the 40% of innervation. First one is the myelinated. On the basis of myelination, we have divided in two things: proprioceptive and nociceptive. Proprioceptive sense of position, like we know our position. That is called the proprioceptive, and sensation of pain is called the nociceptive. They are present, proprioceptive are present in muscle fascia, tendons, joints, capsule. Because this is where man to we should aware of our position. Nociceptive are present in the muscles. Here we can see that alpha motor neuron is going to the motor enclave. Here extraphysial supplying the extra muscle fiber. It will cause the contraction of a muscle. And here is the afferent fibers, means that they are the sensory. The sensory nerve fibers are coming in the spinal cord, where alpha motor are leaving the spinal cord and going to the muscle. Here are two types of sensory nerve endings, like a flower spray ending and annulospiral endings. This is the extraphysial fiber is made up of two types of fibers. Here we can see that the nuclear chain fibers, which is supplied by annulospiral endings, and second is the nuclear brake fibers, which is supplied by the flower and spray endings. Both of merged together, they form the intraphysial fibers. Motor point, site where motor nerve enters the muscles. What is a motor point? Site where a motor nerve enters the muscle. This is the motor enclave. This is going to enter the muscle. This is the motor point where it will enter the muscle. Motor unit, myone, single alpha motor neuron together with muscle fiber supplied by it. Means that it's an aggregation of muscle fibers which are supplied by one alpha motor neuron. This is called as motor unit. The size of motor unit depend upon the precision of muscle control. Small motor unit which are found in the extraocular muscles, like precise movement. 5 to 10 muscle fibers are here, supplied by single alpha motor nerve. There are large motor units, 100 to 200 muscle fibers, which is supplied by single alpha afferent motor neuron. Are found in the muscles of cross movement, like proximal limb muscles. They will cause the rapid movement and forceful movement. Again, there is a neuromuscular junction, means that the neuron nerve is a point at which the nerve communicate with the muscular cell. On approaching the muscle, the axon of motor nerve losing their myelin sheath. Here you can see that myelin sheath is not present in there. Okay, this is a part of a nerve without myelin sheath, and breaks into a number of small branches to supply the individual muscle fibers, and it will break into the small branches which will communicate with the muscle. These specialized motor nerve endings, they will cause the acetylcholine. They will release the acetylcholine here. These acetylcholine will attach on the receptors present on the muscles here. This will cause the contraction of a muscle. It will elicit the action potential of the muscle. Nerve part, motor end plate, like this one is the motor end plate. Presynaptic membrane, this is the presynaptic membrane. Synaptic vesicles, this is the synaptic vesicles. Muscular part, there is sole plate, this is the sole plate. Synaptic cleft, this whole area between them. Granular sarcoplasm, not shown in here. Nuclei and mitochondria, these are the mitochondria. Subneural cleft, these are the subneural clefts. Neuromuscular spindle, this is the neuromuscular spindle. Muscular spindle, nerves are coming there. Spindle-shaped sensory and organ within the skeletal muscle, which provide sensory information to the CNS to control tone of the muscle contraction. Each muscle spindle have two types of muscle fibers, interphaseal and extraphaseal. This is the extraphaseal part, like which will cause the contraction, and intraphaseal part, which will get their innervation by the sensory fibers. Again, intraphaseal have two types: nuclear chain, nuclear brake fibers. Nuclear chain will receive its endings by annulospiral ending, and nuclear brake fibers will receive its endings by flower spray endings. Action of muscles. Muscle tone is a constant tension produced by a muscle for a long period of time, like a constant contraction of a part of a muscle is called the muscle tone. A type of muscle contraction. There are many types we can see here. Isometric, concentric. Okay, isometric means the length will not change, but tension does increase. Here, the length is not increasing. Here, if we can see there is a dumbbell here. If we hold dumbbell, it will cause the tension to increase, but the muscle will not allow him to fall downward. Thus, it will contract, but this contraction will not change its length. Does not change the length. Second is the isotonic. In isotonic, there is a constant tension, but the length will change. Like again, if we see the dumbbell movement, if we are taking one dumbbell of 2 kilograms, the tension will be constant, but we can change our length of the muscle. This is called the isotonic contraction. Eccentric, the length is increasing. Concentric, the length is shortening and bulging. Group actions of muscles. There are 4 types of muscles on the basis of action of muscles. First is the prime movers, agonists, which actually bring about the desired movement, which will cause the movement which we want to do. Antagonist, opponents, means which produce opposite to that movement. Produce movement opposite to the prime mover. They help the prime movers by active control relaxation, means that they give resistance to stable the movement. Fixators, they stabilize the origin of prime mover so it can act efficiently. Means that and these muscle fibers will stabilize the origin of prime movers. Means they will hold up the prime movers so they can act efficiently. Synergists synergists are the prime movers which cross more than one joints. The undesired action at the proximal joint are permitted by these certain muscle known as synergists. When prime movers cross more than one joint, then the movement at the proximal joint is opposed, means it's prevented by muscle fibers known as synergists. These are group of four muscles. Here we will see the applied anatomy. Paralysis. What is the paralysis? Means that loss of power, motor power. Means here we can see that the face is going downward. This is due to inability of muscle to contract either because of damage to the motor pathway or any inherent disease, myopathy. Muscular spasm. It's commonly caused by a muscle pull. Means generalized muscle spasm occur in tetanus and epilepsy. Means the spasm means that they are contracting much more rigorously. Disuse atrophy. When we don't use our muscle for a long time, they degenerate and become thin and weak. This is called as disuse atrophy. Overuse hypertrophy means that if we use our muscle for a long time, then they will increase in their size and become strong. Muscle regeneration. Muscle have limited capability of regeneration, means that it can regenerate small lesions, but if more than 50% of muscles is gone, then it is not possible to regenerate. I hope this video is beneficial for you. uh, I hope you will understand well. Thank you very much.